Welcome to Breaking Point, a podcast from CAPC, the Center to Advance Palliative Care. In this limited series podcast, CAPC invites healthcare workers from across the country to share their eye-opening stories from the front lines of the pandemic. Listen as they give us an unfiltered look at their reactions to the demands they've encountered and the coping strategies they've employed as they reach their breaking point. Your host today is Dr. Andrew Esch.
Hi, everyone. I'm Andrew Esch. Thank you for joining us this week on Breaking Point. Today, we are joined by Corey Kennard, who's the Director of Patient Experience at Ascension St. John's, which is based in Detroit, Michigan. Corey, welcome to Breaking Point, and thanks for being here.
Oh, thank you, my friend. It's so good to see you again.
We presented together, where were we, Arizona?
Arizona, Phoenix, was that 2017? I think it was.
Yeah. Corey and I saw one of the worst basketball games of the year that year, I think.
I went twice, trust me.
You went the next night too? I forgot about
the next night too. So
yeah. Well, lots happened since then, right? Not all of it good.
The world has changed.
Yeah, sure has. What so to that point, what's it been like for you in Detroit? I mean, you're a guy that brings a lot of passion to your work, a lot of passion to the patient experience and how we live with serious illness, and COVID changed everything we thought we knew. So what has it been like for you the last couple of years?
Well, I think on a personal level, it has shown that time spent with family and friends is important. Then on a professional level, with me being both in ministry and in healthcare, from a ministry side, I used to formerly be the leader of our spiritual care department here at this hospital for so many years, about 13 years, and then moved into an administrative role as director of patient experience. And it is from both fronts, it's been challenging, as it relates to both ministry and healthcare. A lot of questions that were unanswered in the beginning, so many deaths that we were seeing that just revealed so many gaps in healthcare and comorbidities that were not being addressed. And I felt more compelled to talk about just health in general and the beauty of life, as we saw so many people perish and leave this earth due to the pandemic, due to COVID-19. And it was just tough. I think it just changed my whole mindset and my whole approach to ministry, and to take every day as a valued day to be alive, and to spend as much time doing those things that you love to do around those people whom you love. That to me is what really happened in the beginning stages. But it was absolutely devastating, Andy. I can't say that enough, because we didn't know what was happening, and it was like a tsunami that had just washed ashore here in Detroit, as well as other parts of the country, as you know. But particularly here in Detroit, we saw a death rate rise to over 300% in the hospital, which was just something that we had never planned for. The idea of building shelving to have bodies to be decently and respectfully laid out prior to pickup by a funeral home was something that we had to creatively come up with, because we wanted to have dignity and respect towards every single person who unfortunately had passed away here in our hospital. So we just found a way to make sure that people were respectfully laid out. And but as you know, the refrigeration trucks or trailers were something that were a necessity as well. And these were just things that just really messed with the human psyche overall with us here in Detroit.
Yeah, I didn't go into medicine thinking I'd ever be worried about refrigeration trucks and building shelving for people that died in the hospital. I mean, there's nothing that prepares you for that. Your role is so unique because you sort of interface between the clinical people, and obviously patient experience is your role. Talk to me a little bit about, as we've lived through the 2+ years of the pandemic, what have you seen on the patient side first? Let's talk about that. Like, For me, my personal experience working with Mount Sinai on their telehealth platform during the early stages of pandemic, the patients I talked to were all in their 80s or higher. And there was sort of a real sadness about what they were living through, but there was sort of a thread in the background that said like, well, they were all very much at the end of their life anyway. They had a lot of comorbidities. So it was sad, but it wasn't devastating. Delta changed that for me. I mean, Delta was devastating. I'm wondering if that's what happened in Detroit as well, or what your experience was.
Yeah, in the beginning, we saw, because of the comorbidities that really impacted people from 40 to 50 to 60 years of age, so on and so forth. It was just something that we saw that ran the age gamut, so to speak. And we saw a lot of families who were just instantly split up. There was, for one, I want to give you an example. I can remember at the beginning of the pandemic, because there was a lot of talk about whether or not COVID was real, and whether or not this was going to be something that was going to be around. And I was walking down one of our hallways in the hospital, going to one of our units, and I saw this gentleman walking towards me, and he was just crying, just overwhelmed. And as he was walking, and I just, the pastoral side of me just said, you need to stop and talk to him. And so when I stopped and I said, sir, I said, can I help you with anything? What's going on? And he said, this is real. He said, COVID is real. And he just started just yelling out, COVID is real. My wife is dying up in the ICU. He's yelling this, in the hallway. And I just kind of just hugged him and took him to the side. And he's just crying, through his mask, everything, just crying. And it was just devastating. He said, and I can't even get to her. I can't even see her, and that to me just broke my heart. That was one of those initial moments that I said, wow, this is going to be, a journey like we've never had before. And it was story after story like that, of people just being totally devastated by not only the death of their loved ones, but the aspect of not being able to be in that room and to touch them and to be around them. And so one of our patients who was in that experience, who did have that experience, actually donated 20 iPads to our hospital. And then there was another person who donated additional iPads who experienced that same thing. And these were people who wanted individuals to be able to some way, somehow connect with their loved ones via an app, FaceTime or whatever the case may be, on those iPads, to help them to make some connection with their loved ones, even if they couldn't do it physically because of the restrictions. And so, some good came out of that with those donations that came about, and people saying, I know I can't be with my loved one, and I couldn't be with my loved one, but here's a device that can help someone else to at least feel somewhat connected, even if they can't be in the room. And so that was just so great. And I spent time programming those and getting those ready, to go out. And I deployed those to in our patient experience department, to our patient liaisons, who were able to take those to the unit. And then also, most importantly, our end of life team, which started during the pandemic for the purpose of trying to keep up with the amount of deaths that were happening, and the nursing, our nursing group not being able to keep up with what was happening. And so we specifically put together and creatively put together an end of life team that just began to do an awesome job with making those connections with family members, using those iPads, and then also beyond just the visual side, using music on the iPads to give people a peace of mind as they were, passing away or leaving this earth. And it just afforded us great opportunities to just look at how creatively we can navigate through this horrific journey together.
You got me thinking, like, we found these little ways to find joy or meaning or things to keep us going during the pandemic. And I think those iPads is one of them. There's these things that happen along the way that you're like, this is awful, but oh, we found this workaround and we're helping in this way. But over time, at least in my experience, you still got worn down because it just didn't end, right? Like, what was the toll that that took on the staff at your in your health system? Like, what's been the experience been like for them? Like, I can't even imagine working on an end of life team in a hospital that had to be put together just because there were so many deaths. Like, was the morale high? Like, just tell me a little bit more about what was happening with the clinicians.
Andy, as probably everyone would assume, it was, strenuous. It was tiring. It was hard, and any adjective that you can describe that speaks to something that would just wear somebody down. And I saw that literally over time. I saw resilient people who were nurses and doctors, who had joy in their hearts coming to work and, being a part of what we were doing here to help save lives and to care for people. I just saw them being worn down over time. And there was, a time where they said, I don't even know if I have the ability to just come back to work tomorrow. These were the things that were being said. I sat with people, clinicians who would literally we would sit down and they would just begin to cry. And they just said, I can't do this. As we watched a nurse, I watched a nurse actually come to me and say, every patient that I've had this week, every patient has died. Everyone has died. That is, if that doesn't wear you down, then nothing will. To actually know that there's nothing that you could do but literally watch a person leave this earth with all the care that you could provide, you saw that it would come to nothing. That was difficult. And so mentally and emotionally, people were devastated, and we're still, let's not be fooled, we're still living in the fallout of that. It's been hard to recover, and it's going to be a long road to recovery. And when you have to go home or and you can't go home, let me say that, you can't go home. There were people who were working here hours upon hours who were afraid to go home to their family members for fear of, giving them COVID. And so we had to provide housing for individuals who were afraid to go home and be around their children or be around their wives or their husbands or their loved ones. And so that was difficult. And so that was an emotional stress and strain on relationships. And, going home and having to be hosed down or take off all your clothes before you come in the house and leave everything in a bag. And, doing that day in and day out was stressful when, you would come home and grab that hug from your family, your kids or whoever, and sit down, wash up, eat dinner. That was lost for months upon months. And, people were just, mentally, physically, and emotionally tired. And I think it impacted how we, cared for individuals. We just became task oriented a lot of times. Can we just get through the day? And I'm not saying that people were cold hearted. I'm not saying that decisions were made that were not in the best benefit of those who we were caring for. But it was just hard when you had all that personal stress and strain that really couldn't be avoided. And that had to impact the work somehow, some way here in the workplace. So, so many people on the highest level, from the administrative part of things, president, CNO, COO, CMO, to directors, everybody felt the crunch. And we tried to support our staff members, our clinicians as much as possible. There's only so much you can say. When people are saying death and devastation and isolation and having to don and doff constantly, and the amount of time that takes to put on the PPE and go in and out of rooms, it just changed the way that we did healthcare. And I can remember walking on the unit and it looked like a war zone. with these tubs outside of every unit, every room, PPE gowns hanging on the, outside of every room. It just looked like a war zone. And it was just a different feeling emotionally throughout the hospital.
So we're friends, right? So I know you. You're the guy that people come to when they want to cry, when it's bad, right? Like,
Right.
But you're also living through this and seeing it all too. Talk to me about what it was like to be you during this. Not only shouldering what you're witnessing, this war zone, but having people coming to you for support. What did you do to support yourself? How have you gotten through?
A lot of nights of crying, to be honest. I'm letting everybody know that's listening to this and watching this right now, just to tell you, to be transparent. A lot of nights of crying, trying to figure out how I could help somebody else when I was struggling myself, when I had family members who were impacted by COVID and even dying from COVID and died from COVID, and not being able to attend services or not to be that support person for other family members. It was tough. I found myself working out a lot, just trying to relieve stress. So I'm a runner, so I run a lot. So just running and just listening to music and just trying to escape, knowing that, just in a few hours, I will be right back into the war zone, so to speak. And then just let me be honest with you, transparent. I think it's just important to find good counsel in individuals, and everyone needs somebody to talk to who can be honest with them and who they can be honest with. And I have a couple of people in my life who I was able to do that with, to just be vulnerable, shed my tears, and to just be real about what I was feeling. And that helped me to be that sounding board for somebody else. But never think that, you can handle something alone. I don't think we were ever meant to handle anything alone. You just have to find those right people to be vulnerable with. And so my friend, yes, your friend here, I was hurting and just devastated like everyone else. And but I had to muster up and do my job of making sure that when I was here in these doors, that I could be here for others. But I had to gain that strength from the outside by talking to individuals who could listen to me and who I can sound things off of, and then get the strength to come back in and to be here for others.
Thanks for sharing that. I know I put you on the spot with that one, but you probably figured I would, right?
Yeah, it's just being real, right?
Yeah.
And look, if I can't be real, I don't want to be here.
Yeah. I think, COVID's gone from sort of a full-on blaze to smoldering right now. And the talk in most states and places is lifting mask mandates and things like that. What's the feeling where you're at? Is it time to do that? Is it time to getting on, or is there still fear that if we do this, we're going to go back and have more surges and deaths and devastation? What's the feeling there?
I think the thought is now, as we look at the numbers drop, it's a sense of relief, first of all, but it's also a sense of we've been here before. And so there's some caution there with us. We're very cautious about this approach. We've lowered our restrictions as it relates to visitation. So more people are able to be in the hospital with their loved ones. And so that's a plus. It helps with patient experience, right? People feel good about, having those whom they love around them. So we've witnessed the impact of our scores when COVID numbers go down and our restrictions go down. We see our patient experience survey HCAPS scores go up. And so it is definitely a plus from that perspective. But also just from a human experience standpoint, that people want to be with people that they love when they're in the hospital. And so, when we're able to provide that, that's good. But right now, the sense is one of being cautious about where we are, but also feeling somewhat relieved about the fact that we're able to relax our restrictions just a little, but we have not relaxed any mask mandates. I think we're going to continue to be a little bit cautious going, forward for the next couple of months or so to see kind of where our numbers are. If we can get down to that single digit consistently, where it's just, single digits in terms of COVID isolations in the hospital, then I think that that would be something that we can look at to relax our mask mandates. But right now, those are still in place and will be in place for the foreseeable future.
You said earlier on, and I think you said it well, COVID just tore the Band-Aid off of everything that was wrong in healthcare, right? How do we, it's funny, at the beginning, I wanted to go back to the way it was in 2019. I used to keep saying, oh, I wish for the old days, right? Like, I wish we could just go back, but it wasn't that good. In fact, it was awful. Healthcare is racist, it's siloed, there's so much wrong. Like, how do we come out of this moving forward? And you've been, you're kind of on both sides, right? You've been in the spiritual care side of patient care and probably still are. You're in the administrative side. What's the way out of this? What does the future look like for us?
I think the future looks like one that has a great opportunity for us to capitalize on the things that we missed out on before. COVID has, and I say this cautiously, COVID has been a gift to us in healthcare because it has opened our eyes more to the health disparities. It has spawned various committees now that are dealing with diversity, equity, and inclusion as it relates to how we move forward. And the excitement around that and the inclusivity of individuals and the opportunity to share and to educate the community more about health so that we don't have the amount of comorbidities that we have present and prevalent throughout the community, especially in the African-American community here in Detroit. It has shown us specifically that we have a lot of work to do and we need to roll up our sleeves and begin to do that. So the way forward for us as a healthcare system and as a society with healthcare involved is one of communication about health, communication, and opportunities to bring people together to talk more about this subject and to provide resources, more resources to those underserved communities in our society that will give them an opportunity to have a better chance of surviving, dare I say, any type of disease or onslaught of any pandemic that may arise in the future, but also to give people an opportunity just to live healthier lives. And so prior to the pandemic and hitting us hard in 2020, I think that now we have a better grip on, what a better life can look like and how we can help people to live a better life so that those who died won't die in vain or would not have died in vain who succumbed to COVID-19. So it gives us an opportunity in their honor to seek how we can help others to avoid such a fate in the future. And so I see it as an opportunity, but we have to roll our sleeves up and we have to be more community oriented as healthcare systems and provide ways and resources for individuals to feel like we are a system that they can trust, and then a system that will not wait for people to come to where we are, but we're going to go to where the people are in the community and be a part of their lives. And once again, educate, and then provide resources that can reinforce that education to allow people to live a better life. So I think it's a great opportunity for us if we take advantage of it.
We missed each other when I was in Detroit last time. Our schedules just didn't line up and we didn't get together. But when I'm up there next time, we got to make that happen. I miss seeing you in person.
Oh man, it'd be great. It'd be great. And we can just, grab a bite to eat and just sit down and talk, but then, introduce you to some people here in this area and in this hospital. And I think it'd be great. So I'm looking forward to that, Andy. Let's not make it such a long time again.
Yeah, you betcha. Well, we recorded this, so we'll hold each other to it. How's that sound?
There you go.
Well, thanks, Corey. It always brings me such joy to see you and hear you talk. And I think your thoughts about the future and the opportunities that it presents coming out of this, I share those with you, and you articulate it in a way that I could only hope to. So thanks so much for being on, and hopefully our paths cross soon.
My pleasure, my friend. Good to see you. Thanks so much.
Good. All right.
All right.
Thank you for listening today. For debriefings, the Emotional PPE Toolkit, and more, visit capc.org/COVID-19.